healthcare. This is Consumers Doctor on the behalf of Foremost Organization. Today's topic: don't be fooled. Yes, don't be fooled when it comes to healthcare. It doesn't take a rocket scientist, folks, to understand the healthcare. So don't be fooled, because there's too much at stake for you and everyone else. These elections have consequences. Elections have consequences. We're waiting for the Georgia senatorial race. We will see what President Biden does. So today's topic is don't be fooled. Political health reform proposals are typically confusing. It's on purpose, folks. It is on purpose. It's a political sleight of hand. Political sleight of hand. So don't be fooled by politicians. Don't be fooled by politicians and health industry lobbyists. Health industry lobbyists. There are trillions at stake, folks. When the country has spent 3.7 trillions and ranks 38th among the most advanced countries, it is shameful. It is shameful. America doesn't rank, even though it spends $3.7 trillion. It ranks 37th. It is shameful. There are a lot of lobbyists in Washington. And the politicians are in the pockets of lobbyists. That's shameful. When I say don't be fooled, don't listen to these slogans and, innuendos. They try to sound smart by purposefully making things complicated when it comes to healthcare. Purposefully make it so complicated. One trick, they used to point fingers of blame on someone else. Yes, we have a dysfunctional healthcare system, folks. It is shameful. We are not able to come to it. Americans too smart for all this. So watch out, folks. Watch out. The insurers blame the hospitals. Insurers blame the hospitals and doctors. Hospital blame insurers, and doctors blame lawyers, and employer blames non-compliant employees. Politicians blame politicians, and so on and so on. This blame game goes on with no solutions. One size fits all approach. The other side is market-based. But Americans were never given an option. American consumers were never put it in the front line, folks. This is where the problem lies. American consumer or customer is never in the front line. When they legislate from Washington, customers are ignored. Consumers are ignored. You know why? There are trillions at stake, folks. Trillions at stake. Healthcare, it has surpassed the national defense budget. So when you have that much at stake, there are lobbyists, folks. This is where the problems are. There are lobbyists, and Americans need to realize they use another trick. They use another trick. other than blame game. Comprehensive solutions. This is a trick they use in Washington a lot. Comprehensive solutions. In 2019, healthcare spent 17.8% of the gross domestic product. Gross domestic product. You know what other countries have spent on their healthcare? It is really shameful for America to be in this position, ranking 37th. Let's compare with India. You know how much India has spent on the gross domestic product on the healthcare? It is really shameful when you compare with India. It's 1.5% of the GDP. India has spent only 1.5%, and here we are. The largest democracy in the world has spent 1.5%. Here we are. America is supposed to be number one democratic country. They have spent 17.8% of the GDP, and we still rank 37th. We still rank 37th in the world, folks. America needs to be number one in delivering healthcare. How do we get here in this mess? You may ask. A simple solution, folks. Customers and consumers have been ignored all this time. Consumers have been ignored all this time. Consumers were the last. America is the best in free enterprise. I can't believe American consumers have been ignored to this day. Whereas look at the retail sector, look at any other industry. Consumers are in the driver's seat. Why is it makes it so difficult when it comes to healthcare? Healthcare. Look at the groceries, food chains. They are the best in the world. America has been the best as the cost of delivery of the groceries, you name it, any product. America is the best. When it comes to healthcare, it is because these lobbies, the insurers, have been controlling this industry for too long, folks. We need to have a customer-driven healthcare, customer-driven health premiums like any other industry, like auto insurance, home insurance. Why can't we have health insurance in the front line where Americans can choose the best premium what they need? Why can't we do that? Why is it that it's so difficult for American consumer to be in the front line to shop for the premium? So difficult because insurers, they don't want you to. Insurers, lobbyists, they don't want you to be in the front line. Any industry that large will have lobbyists like in healthcare sector, and they have vested interests, folks. Insurers have vested interests. They suggest over and over again comprehensive reform. My foot. Comprehensive solutions include so many extra items. Everyone is against some part of comprehensive plan. Someone is against comprehensive. So nothing gets done, folks. Nothing gets done. They assume Americans are stupid to understand the bills, medical bills. They don't give a damn about bankruptcy. They don't give damn about you. They don't give a damn about customer. They don't give a damn about consumers. They use industry and political shorthands like COBs, CONs, HTHP, CDHC. There are too many abbreviations to make it confusing, folks. They make it deliberately confusing. to reinforce that we couldn't possibly fathom to understand the complexities of healthcare. They think we are stupid. Really. They think Americans are stupid. We have come this far, and everybody is trying to put the Americans the last, consumer the last, customers the last. They don't put the customers in the front line. They don't put the consumers in the front line. They don't want you to be. Everybody wants to control. When it comes to the total freedom in healthcare, Americans demand total freedom in healthcare. They demand total freedom in healthcare. It doesn't take a rocket scientist to know the difference between the health and the insurance. It doesn't take a rocket science. What is health and what is insurance, folks? It doesn't take. They are both intertwined. Healthcare is simple, folks. Healthcare is when you receive the care from the providers, doctors and hospitals. That's the health care. When you provide the services, like when you go and shop in Walmart, Amazon, online, when you receive services, telemedicine, telehealth, you can be seen in the hubs, you can be seen in the outpatient. They are services, folks. And health insurance is how one finances the services. So far, everybody is trying to manipulate the financing part because there's a lot at stake, folks. There are trillions of dollars at stake. When it comes to the payments, these services payment, insurance is a must, folks. Insurance is a must. Don't take me wrong. Financing the healthcare, we need to pay for the services. How you pay for the services is an issue. How we pay for the services. Do we pay for the service as we receive the care? That is probably the wiser way to do it rather than this billing. This billing system has corrupted the industry, folks. Surprise medical bills, consumers getting these medical bills, they are destroying the families, they're destroying the health care as an establishment by these stupid billing services. The way they set up this billing, the CPT codes, DRG codes, they're not the right number, folks. They're not the right number. Insurers are resisting the risk fragmentation. You are paying right now as we sit. You are paying for everybody else's health. Among 320 million folks, you're paying for the obesity. You're paying for everyone is paying for everybody else. And insurers are resisting to fragment. It's called so-called risk fragmentation. Risk fragmentation, the way it works, into 4 categories, folks. 4 categories. Well category, which is majority of the Americans are in the well category. They need to be segmented into the well category so you can get the best premium, so you can finance for when you don't see a doctor, when you don't use the services, your premium should be a lot less. So that you need to be compared among the well category. That's a majority of the Americans. You need to be segmented in the well category. When you have an acute conditions, when you have an acute or at-risk conditions, when you're a smoker, you don't take care of yourself. When you're obese, you don't take care of your health. When you're into drugs, you don't take care. So they need to be segmented at risk because they are prone for injuries. They are prone for, you need to be compared among the at-risk group because you're at risk for those acute illnesses, because you get pneumonia, because you're smoking, you get stroke because you have a high blood. They need to be compared in that category. And we need to bring down the cost in that category by being more proactive, by segmenting. And your premium has to be based in the risk segment category, folks. You need to be segmented in the risk. And your premiums can be lower. There are ways to do it, folks. And there's only 15% of the American population have chronic illnesses. Look at it. We can handle the 15% of the people who have chronic illnesses. We can do a damn good job by categorizing into chronic illness. There are only 15%. They are claiming 48% of the claims. And those claims are exorbitant. And that's where the cost is going up, because providers, what they're charging are made up numbers. They're not the right numbers, folks. They're not the right numbers. Consumer demands affordability. When consumers are in the driver's seat, they want to know what they want to demand affordability in services, simple services for pregnancy, labor, simple services, having a child. They demand transparency and affordability for a labor. The other day I came to know they were charging $680,000 for a delivery, and there's no competition. And this company, I don't want to name the company, but this company is buying up other hospitals, and there are monopolized. This is in California, folks. This is in California. They're charging $680,000 for just simple labor or C-section, whatever it is. But that's not right. So these people, Americans, demand not only affordability, transparency, and competition. They want competition. They don't want consolidation of these big companies. Americans demand affordable costs. Demand affordable costs. So Americans need to be in the driver's seat. Americans, customer. The way you do it, there are a lot of simple ways to do it, folks. It is not one size fits all approach. What Americans need, the tools. That's what they need, the tools. So by risk segmentation, you can lower the cost. So health insurance reform should be a public-private partnership through a public-private partner. I'm not saying completely private. Let's do it through a public-private partnership. 176 million who have health care through employer-sponsored health plans or insurance, through individual health insurance policies. We need to make it easier for the employers and employees to get the best premiums and the best cost for these folks. These people already have private, but we need to make it better and more, and we need to make the costs. If the American consumer is in the driver's seat, they will be demanding what the cost of the care for each service, for any service, anything to do with providing a service. Consumers needs to be in the driver's seat, folks. There is no other option we have. When you have majority of Americans already have a private health care. What we have is only 27 million uninsured. We can't tackle that. I don't understand the logic. To cover the 27 million folks, you want to punish the rest of the whole country just to take care of the 27 uninsured? That is not right. You cannot punish All these Americans who have the care they already have, you cannot punish them. Give them the tools. Provide the uninsured. I want these 27 uninsured Americans to get a personalized health care, and we need to focus on these folks. It doesn't matter if they're economically impaired or physically. It doesn't matter. It doesn't matter, really. Focus on these groups, folks. Let's focus on these groups. If President Biden, if you're listening, focus on the uninsured. You have no right to go after the private health insurance industry. You do have no right. We will fight for it. We will fight. Because people who have the best insurance, you cannot take away their health insurance. Almost over 200 million, 250 million Americans have private health insurance. You cannot take away their health insurance. You need to make it better, not take away their. You cannot force upon one size fits all on all the Americans. Address what you need the most. 27 uninsured, give them the tools what they need by health review authority, by appointing a health review authority under the public-private partnership. It doesn't cost Washington a penny. It doesn't cost a penny by public-private partnerships. Health Review Authority will have all the tools they need to take care of the impaired and take care of the disabled folks, people who have real health issues. We need to address them the most by categorizing the people who really need. People with chronic illnesses need to be taken care of. You cannot just wishy-washy this stuff and punish the entire country who have the private insurance. You can't do that. Let's segment this risk into chronic category, and there's 15% that have a catastrophic illness, and let the customer or consumer choose whenever they need that coverage for a limited time, for extended time. Let Americans choose the catastrophic coverage. Give them the affordable premium so they can make a choice. You cannot make a catastrophic coverage on all Americans. They don't need it. They really don't need it. I have no idea what this next administration is going to do. It all depends on the Georgia senatorial race, folks. But Americans are smarter, and these insurers and this representative Washington making it too complicated by ignoring the fundamental fact that Americans need to be in the driver's seat for healthcare. You're ignoring the consumer. You're ignoring the customer. They're the only one who can solve the healthcare. Not the Washington, not politicians, not anybody else. Consumers, customers are the only one can solve this healthcare disaster. Right now, healthcare is so dysfunctional. You cannot dictate from Washington one size fits all. Medicare is already bankrupt, folks, and you want to make it Medicare for all is such a stupid idea. It's a stupid idea. Medicare doesn't have the money to take care of the seniors already. And why do you want to make it force upon rest of the Americans to have one size fits all? It just doesn't work. Medicare itself is broke. You can't do that. By giving the rights to the Americans, they know they can handle it. Give them the tools what they need. Especially Health Review Authority can give a certified guaranteed coverage. Those people who don't get the insurance, they lose the privilege of exemptions when they file their taxes. So there are consequences by not having health insurance. So people will realize they will get the coverage. Everybody will get the coverage because they lose the privilege for themselves and their families. That is rather than mandating people to buy something which they don't need. Give Americans the tools. Appoint a health review authority under the public-private partnership. Even Democrats believe in public-private partnerships. I have seen so many Democrats believing in public-private partnership. That is the way to go, man. That's the way to go, man. President Biden, if you're listening, that's the way to go. Public-private health review board will give a certificate of guaranteed coverage for everyone who needs it. Everyone who needs it. These things for consumers. Consumers are smarter. Give them the values. Give them the right direction. Don't destroy like what they did in the welfare system, folks. We don't want another welfare debacle. Clinton did the best thing by implementing certain things in the welfare, but welfare was a debacle, destroyed the entire race. Thank you, guys. Salute. We'll see you in the next healthcare segment, folks. Thank you. I love you. I love you. I'm very gratified to be an American, and the least I could serve to these folks. Thank you.